Good morning, happy Monday. I have 2 IVs I need to do today, but we need to restock our bag because it's looking a little crazy. So let's do that. I'll show you everything that I include and make it look pretty again. First things first, I'm going to take everything out. The 2 IVs I'm doing today, one is a nausea morning sickness IV, the other one is a cold and flu. So when we do the cold and flu, because we use 3 different medications, we actually use the 500 ml bags because we're only allowed to put 2 medications in each bag. So I have to make sure that I stock enough of those to be able to accommodate those patients. So I have 4 bags of normal saline that I'm going to put in this. For the other IVs that only require 2 medications or just 1 medication, so anything like hangover, which just gets B12, or the morning sickness also only gets B12 as well, you can use a 1 liter bag. So we put a bunch of these in there. Now I have lactating ringers and normal saline that I like to include. Fully stocked because if we're out with our other patients and we have something else that can be picked up, then I want to make sure that I have enough if I can. We want to make sure that we have all of our other supplies available and ready for us to just grab and go from. So we need to make sure that we include a bunch of Tegasly, plenty of alcohol wipes. I do have 24 gauge needles, which I have been using a lot of recently for a couple of my hard stick patients, but I also have 20 and 22 gauge that I bring with me, and the hope is to always at least use a 22, if not the 20 if I can. We only get 3 chances to poke someone, so if you can't get it after the 3rd try, then again, just like in the hospital, you're done at that point. You can call in reinforcements, see if anybody else is in the area to help. But these are all auto-occluding needles, so you don't have to worry about the backflow of blood just getting everything all messy. Include are the syringes and needles for when we do the medication into the bag. You need to make sure you have enough of the IV administration sets. Coban for after. So the medications that I include or that I have on hand are 1 Zofran for obviously nausea, and then I also have Benadryl, which we use for, obviously can be used for nausea too, intractable vomiting. And then I also have Toradol for any sort of pain, headache, migraine. The Zofran have very similar tops, so make sure you're grabbing the right one. Other bag. I thought I was out, but the other medication that I do have is Pepcid. So include all of our